Welcome. My name is Tim Rebick. I'm the Vincent L. Gregory Professor of Cancer Prevention at the Harvard Chan School, and I am thrilled to be here to lead this session on healthy hydration, sponsored by the studio, the Harvard Chan School of Public Health, and the Zhu Family Center for Global Cancer Prevention. And I'm joined today by three experts on this topic: Eric Rimm and Walter Willett, who are professors of epidemiology and nutrition at the Harvard Chan School. And joining remotely is Anna Grummon, who's an assistant professor of pediatrics and director of the Stanford Food Policy Lab and a former postdoc here at the Chan School. So for our session today, we think a lot about the exposures we have and how they impact us. We think a lot about our food. We think about physical activity. What has been less of a conversation is what we drink, what beverages we consume. And so, from our first cup of coffee in the morning until having a glass of wine with dinner and having an energy drink, whatever it is, these beverages are woven into our lifestyle and our celebrations and our cultures. Yet the health impacts of these choices that we make, especially when it comes to cancer and the long-term effects on chronic disease and health, has been confusing and sometimes controversial, and it's sometimes driven by marketing and commercial interests or social media or what we hear from our friends and relatives. We've heard a lot of things over time, and some of that is not consistent. It's not clear what to make of this, how to make choices. And so that's what we're here to do today. This panel is here to talk about what we know, what the evidence suggests about things like alcohol, sugar-sweetened beverages, coffee, milk, water, and how we can think about making better choices to maximize our health and to limit the chances that we'll develop cancer someday. So we're also going to talk not only about individual beverages, but the patterns of exposure, the patterns of consuming different kinds of beverages. And we hope to be able to give you some insight into the best scientific evidence, the best ways of making decisions, and not to give you rigid rules, but to help you be informed about the best way to live your life and to be as healthy as you possibly can. And so I'm just going to give you some scenarios. We're going to have a discussion about different scenarios and use that as a guide for us to think about how choices can be made for everyday life. So our first scenario, it's Saturday evening. You're out with your friends or your family, and you're wondering whether you should have that glass of wine or two with dinner or afterwards. And we need to think about how to make that decision. And you've heard a lot of things, maybe that wine might be good for you, it might be bad for you, alcohol has health benefits versus risks. There's been a lot of discussion about this in the past, and you may be confused. Or at least concerned about how to make healthy choices for yourself. So let me just ask our panel, starting with Dr. Rimm, what do we know about alcohol and cancer risk? What does the epidemiology tell us? And what are the best choices that we can make based on the evidence we have available?
Thanks, Tim. That's probably a 2-hour discussion that we can have just on that question alone.
We'll stay here for that whole time. Yeah.
Let's start out with sort of setting where we have been over the last decade, and I would say that 70 to 80% of men in this country report having one drink in the last month, at least one drink. And it was about 50 to 60% of women. And that actually has gotten a little bit less in the last few years, and we're not quite sure why that is, if it's policy things, if it's guidelines, or if it's just that marijuana is more readily available and people are choosing marijuana over alcohol. But so how do we study this? In terms of cancer prevention, there hasn't been a huge, long clinical trial of alcohol that has followed people for 10 years to say people who are randomized to alcohol versus not randomized to alcohol. But there have been dozens and dozens of studies where they have randomized people to alcohol just for short periods of time, for a month, for 2 months. Some have gone, one or two have gone for 2 years, where they literally gave people alcohol to drink at night before they went to bed, and they gave other people juice or something that was equal in calories. And in those studies, you see benefits and harms. You see people's good cholesterol go up. You see their blood propensity to clot go down. All of those would be good for lowering your risk of a heart attack. You see their insulin sensitivity improving, so that would lower your risk of diabetes. Yet you see hormones changing, and you see DNA damage, so that would increase your risk of cancer. So just from the biology standpoint, we know what to expect if we look in large populations. And then if you look in large populations, the first study was done in a large population. Kaiser actually was done 50 years ago, showing that people who drank in moderation had lower rates of heart attacks. It actually surprised the investigator. He didn't expect to find that. And there's been many studies, including those done by Walter. Walter was one of the first to show that alcohol, a drink a day, increases a woman's risk of breast cancer by 10%. So a lot of it comes down to making those personal decisions when you're at the table going, there's risk and benefits from doing this. A lot of what we don't know yet about alcohol is the importance of drinking pattern. And we all can joke about it. Like, of course, you shouldn't have 7 drinks on Saturday night and no alcohol the rest of the week. But when you fill out a questionnaire and someone says, how much do you drink on average? And you say, I have a drink a day, that could be 7 drinks on Saturday night and 0 the rest of the time. And we know that's detrimental. And it's probably increases your risk more for cancer because of the metabolites of alcohol. So it is tricky, but there have now been hundreds and hundreds of thousands of people followed. Following means you ask them before they get sick, how much do you drink on average, and you follow them for 10 or 20 or 30 years. And what we know is that people that drink about a half a drink to a drink a day live the longest. So they die less of heart attacks. They may have a little bit more cancer, but the absolute risk of heart attacks is much greater than the absolute risk of breast cancer or colon cancer. So that's kind of the 30,000-foot view of alcohol and health. So I think it does come down to cultural, why people drink in the first place, what their drinking patterns are. And people, if you do drink, you can drink moderately, light to moderately.
And what do you mean by moderately? I mean, that's always a question that, is it 1 drink? Is it half a drink? Is it, it's not 7 drinks, but what is that?
I mean, the definition that has been used, except for the guidelines that were just released 2 weeks ago by the US government, the guidelines have said since 1980 when they were released is up to 1 drink a day for women and up to 2 drinks a day for men, and not more than that, and spread out over the week. So, and that's because women metabolize alcohol a little bit differently. On average, a woman's smaller, so their blood concentrations would be higher with a single drink. So it looks like that is the level by which people live the longest, but you would never advise an entire population to start drinking. So if you don't drink, it's not a good reason to start just because there may be health benefits or risks. I know some people who may be at particularly high risk for cancers, maybe breast or colon, maybe want to drink a little bit less. So those are personal decisions you have to make sometimes with your doctor about, I'm taking this medication, I shouldn't be drinking, or sometimes like, I just don't feel comfortable in social situations unless I have a drink, then I'm more relaxed. And so sometimes people drink for that reason, in which case it's not an overall long-term health, it's because I feel like I can't socialize with my friends unless I'm a little more relaxed. So.
Yeah, and so, Walter, Willett, the IARC, the International Agency for Research on Cancer, classifies alcohol as a class 1 carcinogen. I mean, it's as bad as any other carcinogen out there, at least with that rating. So, you've done a lot of the work that led to us understanding the risks of cancer. Can you talk a little bit about breast cancer or how to communicate those messages with the public so what Eric just said is maybe there's a balance in drinking and overall health and lifespan. What about cancer?
Right, yes. I, in fact, chaired the WHO committee quite a while ago
Yeah.
in France and came up with that declaration that alcohol is a human carcinogen. And as Eric said, there's a situation where we have some pretty clear benefits. It's a little bit controversial on the heart disease side, but I think the evidence is actually quite strong. And there's also been adverse outcomes. And of course, we aren't talking about much today, but the really big ones are addiction and alcoholism and crashes if you drink and drive. And people understand that, but we can't forget about those. And we've known for a long time that high alcohol consumption, 3-4 drinks a day, increased risk of oral cancers, esophageal cancer, and a couple other cancers. What really, I think, changed the picture, though, was the evidence for breast cancer, where we could see in our studies that we reported in the mid-1980s even at about 1 drink a day, there was a detectable and statistically significant increase in breast cancer risk, and it just went up from there. And with our longer follow-up, now we can see an increase in risk with about 3 or 4 drinks a week. So people were shocked that we could see increases in risk of cancer with what we thought were small amounts, but actually those are the same amounts that seem to help reduce risk of heart disease. So there is a biological effect at those modest amounts of alcohol. Eric mentioned this trade-off, and one aspect of this trade-off is really very much relates to your underlying risk of heart disease or breast cancer. And if a woman is under age 60 or 65 and doesn't smoke and has a generally good diet, risk of heart attacks, or especially dying of heart attacks, is extremely low. But breast cancer is common. So for such a person, again, a relatively young woman in good health, the balance is going to pretty clearly be on the harm side. But how big is that risk? It's not like smoking and lung cancer. There's various ways of conveying risk, and we're debating amongst ourselves how do we best convey risk. But the commonly used statistic is that about 1 in 8 women will develop breast cancer during their lifetime. And if you drink about 1 drink a day or a little bit more, that statistic goes from about 1 in 8 to about 1 in 7, or another, which isn't big, but again, if your risk is substantial, that underlying risk is substantial, that can be important. And looking at it another way, we advocate mammography and do quite a bit of investment in that. And this, with the alcohol intake of about 2 drinks a day, that would counterbalance the benefits of mammography, even a little bit more than counterbalance the benefits of mammography. So again, if you sort of put it in that context, this is potentially important. So that's again, we're not telling anybody you should do, should not do something, but this is information I think that could be helpful for people to putting into their decisions about what they decide to do on a daily basis. And again, a lot of it depends on your underlying risk.
Well, and to those points that you both made, we all do dangerous things. We ride in a car and we can get into an accident and be killed, but we also wear seatbelts, and cars have airbags. So the trade-offs, to me, it's not just are you drinking alcohol, but what is your lifestyle? Because if you're at risk for heart disease, there's probably many things you should be doing. If you're at risk for cancer, there are other things you should be doing. Do either of you want to put that into context of which you just did, which you just started doing, reducing your alcohol exposures or making choices where you minimize that part of the risk? What if you want to choose to drink a little bit more? Then you should balance that with other lifestyle choices. Is that helpful to say to people?
I mean, I think an epidemiologist would always say that, like never just pick one thing going, well, I'm just going to go out and reduce my risk of heart disease. I can just drink more, and who cares about how much I weigh or how much I exercise. I mean, there are other ways to look at that, and of course, we've done things for heart disease, Walter and I and colleagues, where you sort of look at all the choices that people make and how much can you reduce your risk of heart disease by doing a lot of good things, by exercising, eating right, if you drinking in moderation. And then we actually, one of colleagues and I, we actually looked at what happens if you did everything healthy. Then does it make a difference to drink or not? And it still was really important for reducing your risk of heart disease. So even among the people that did everything healthy in terms of what they told us on their questionnaires, they still had a fair bit of heart attacks. There weren't a lot of people in that group because there weren't a lot of our cohort members that did everything healthy. But even among that group, those that drank had lower rates of heart attacks. Now, you probably could do the same for breast cancer. You could probably say people that had all the right things for lowering the risk of breast cancer, if they drank, that probably still would get slightly increased risk of breast cancer.
And one of the important realities is that we know a lot more about ways to reduce heart disease risk. We can see by fairly reasonable changes in lifestyle, not smoking, healthy diet, avoiding sodium, exercise, etc., we can prevent easily about 80 or 85% of heart attacks. For breast cancer, it's more challenging. There's not a handful of things that make such a big impact as they do on cardiovascular disease. And that's why it's worth paying a little more attention to the alcohol part of the picture. But very importantly, though, it's not a 0 or 1. It is about the dose. And a lot of people in the breast cancer world are saying limit drinking, if you really want to keep your risk low, to not more than about 3 drinks per week. And at that level or below, the risk becomes quite small and hard to detect statistically. And so part of my advice is if someone would like to drink, have something you really enjoy and enjoy it each sip carefully.
Right, yeah, very good, yeah. And so Anna Grummon, hearing this and knowing what you know about the complexities of exposure and making choices, I'd like to hear a little bit about how policymakers think about this, because the kinds of things you just heard are very subtle. You know, balancing risks, balancing other risk factors. But when you get to a policy level, you can't take into account that level of subtlety to an individual. How do we think about getting a policy in place that balances health and alcohol consumption in a way that is, you know, policy friendly, guideline friendly?
Yeah, it's a great question. I think policymakers have really relied on work by people like Dr. Rimm and Dr. Willett in making those decisions and understanding, when we add up all the alcohol consumption across the population, are we drinking a little bit too much as a country or a little bit too little? And then what policy levers can we use to try to nudge consumption in a healthier direction? And what we see in the data is that, as Walter mentioned, many the harms that we worry about with alcohol consumption, a lot of those are not necessarily around heart disease or cancer, but around addiction and motor vehicle crashes. And these are significant contributors to the overall death rate in the US, suggesting that we might want to nudge average consumption down in the population. Certainly, I don't think any policymaker is interested in getting to zero consumption. I don't think that's, we want to go back to prohibition, but I think there's interest in sort of moving the curve a little bit to the left towards lower consumption, more people meeting the guidelines that Eric mentioned.
Yeah. No, that makes a lot of sense, and you know, the guidelines are just guidelines, and so hopefully people can understand them well enough to be able to still make informed choices. Because you know, if you're pregnant or if you're going to get in your car, you shouldn't be drinking, maybe. But beyond that, the guidelines that say how you should approach your cancer risk should be probably much more subtle and harder to interpret. Yeah. Thanks. So we've just been talking about alcohol and cancer and other diseases, but obviously that's not the only beverage that we consume. We've got water on our desks here, and you know, so think about you're getting up in the morning and you're having breakfast. You have a lot of choices of beverages that you might want to think about. So you might have coffee, you might have juice, you might have milk, and you know, later on in the day you might have a soda with a sugar-sweetened beverage or a diet soda, and it would be helpful for us to also put into the context how these beverages, how their consumption might influence cancer risk and other healthy choices. So Eric, how do you think about, let's just take sugar-sweetened beverages, which have been in the news a lot. How do we think about those when we're making choices related to our health and to cancer in particular?
Thanks. So we've gone from a really hard topic to, I think, a pretty easy topic.
Oh, good.
That sugar-sweetened beverages, obviously they have appeal. They taste good. They taste, you know, makes people feel happy. There's a lot of commercials about them. There are lots of very subtle nudges that are put into movies and TV shows showing us a sugar-sweetened beverage. And as you mentioned earlier, there's a lot of corporate involvement. A 12-ounce can of the most common sugar-sweetened beverages that you're all thinking, but I won't say during a live stream, has about 150 calories, or has 10 teaspoons of sugar in a 12-ounce container. So, I mean, you can imagine having a cup of coffee. Rarely do I see someone opening up 10 teaspoon packets and putting that much sugar into a beverage. So it really is a targeted high intensity caloric beverage that when you drink, you know, people drink them in 10 minutes, 20 minutes, or 30 minutes. And so when we think about beverages for cancer prevention or chronic disease prevention, or when Anna thinks about labeling them or taxing them, we really think about compared to what? Like, okay, I probably shouldn't have this 12-ounce or 20-ounce soda. What else should I have? And so when you compare a soda to water, or a soda to coffee, or a soda to tea, whatever you're comparing it to always wins in terms of, and it probably goes through, a lot of the cancer prevention probably goes to the fact that we see in many studies that sugar-sweetened beverages increases risk of obesity,
Right.
which then leads to potentially several other types of cancer depending on when the obesity develops. But also leads to diabetes and also leads to heart disease and stroke because of that. So I think that one's a pretty straightforward question in terms of I think we all should be reducing or eliminating sugar-sweetened beverages in any way. And some of that is the energy drinks and the things that have caffeine that are really small but have intense amounts of caffeine. There's other ways to get caffeine than having a whatever thing that gives you wings. So I think that we really should be thinking about, okay, so what should we have instead?
Yeah.
And I'll let Walter talk about that because we've done a lot of analyses on instead of sugar-sweetened beverages, how can we reduce chronic disease risk?
Yeah, please.
Sure. Well, as Eric said, sugar-sweetened beverages are easy. There's all harm, no benefit, basically. But what about the alternative? We are talking about hydration, and we do have to have some fluids in a day. And there are choices. Eric and I grew up in Wisconsin, America's dairy land, so we have to talk about milk before anything else is the alternative. And that does get into really complicated biology. And for cancer risk, it's a trade-off. Basically, we see some benefits for colorectal cancer with dairy consumption, probably related to the calcium content, but we also see some increased risk of prostate cancer and maybe endometrial cancer as well. So it seems sort of in the middle there. For coffee, lots of evidence that there's some benefits for cardiovascular disease and overall mortality. Modest benefits, but in that direction, the evidence is very strong. What about artificially sweetened beverages? Of course, that's the big question that people are asking, and there's a lot of promotion of diet, this or that, in terms of instead of the full sugar or sugar-sweetened beverages. And we've looked at that pretty carefully, and it does take some careful thought and careful analysis because a lot of people are drinking diet beverages because they're already overweight and trying to lose weight. And so we see that as what we call reverse causation in our epidemiologic studies, that the outcome, obesity, is driving the behavior, moving to a diet soda.
Yep.
And so if we look at that carefully, though, we do see that the artificially sweetened beverages are far less harmful than the sugar-sweetened beverages. Whether there's some little increases in risk, we can't be sure about that, but pretty close to water, actually, in our studies. In terms of weight gain, in terms of overall mortality, in terms of diabetes risk, clearly having the diet beverage would be better than the full dose of sugar, which is a huge dose that we get when we drink it. I won't name the name either. But but we do have to be a little careful that these artificially sweetened beverages are sweetened with aspartame, a specific artificial sweetener. There are several dozens on the market now, but in terms of beverages, they're almost all aspartame. So we can't be sure if we use some other sweetener that it might have a different effect than the aspartame. And we looked at aspartame really carefully. Just published an update on breast cancer with many thousands of cases of breast cancer, and there's no hint at all of an increased risk of breast cancer, given that that had been raised as a concern. But we come back to it. Water is still our basic go-to beverage, and low cost. I think that should be the first choice. And on our healthy plate, that's what we have next to the plate.
So just quickly to add in, even though Walter said that there doesn't seem to be a relationship to breast cancer, we do have some new research now showing that artificially sweetened beverages, or the artificial sweetener, actually does change your microbiome more than comparing people that drink sugar-sweetened beverages versus artificially sweetened beverages. You do see changes in the bugs that are trying to metabolize either the sugar from the sugar drink or the compound, aspartame or whatever the compound is that's getting to the microbiome. So what that means long-term, I don't think we know, but we do know there's a little bit of difference in the bugs that you have if you are a long-term heavy artificial sweetened drinker versus a long-term sugar-sweetened beverage drinker.
But it could be good or bad. You don't know yet.
No,
Okay.
correct.
Yeah, and you know one of the concerns that's been raised over many years is that some of these artificially sweetened beverages contain cancer-causing agents. Maybe you could just say a word about whether people need to worry about these artificial sweeteners as carcinogens themselves.
Yeah.
Mostly animal studies, I don't know.
Yeah, right.
And
Just
there were some concerns from some animal studies and high doses, but we have looked at pretty carefully. There was one subgroup of cancers, leukemias and lymphomas. We did publish a paper. There was a little blip there, but it wasn't consistent in men and women. We need to go back and look at that in a little bit more detail. But across a wide swath of cancers, we've looked pretty carefully, and we don't see any risk there of from, again, the artificial sweeteners in beverages
that we consume today.
Right,
Yeah.
right, yes.
Yeah.
Yes. So the bets are off, and we just don't have good data from a lot of the other artificial sweeteners because we haven't had enough people using them for long enough to be sure about their effects on human cancers.
But it's probably fair to say that if there was a big increase in risk based on these artificial sweeteners, we would probably have seen it by now. So if it's there, it's small. That's a question. Yeah.
Some of them we can't really. The duration of using it is
Have
just
to be
too
the
small.
packets that people use in coffee, because you can get 3 or 4 different types that you open up. So that since aspartame has been in the diet sodas, but you can get the other sweeteners that people have instead of aspartame. And we measured that.
It's part of the issue is over time some have come and gone and it's up and down.
Sure,
So
it's complicated.
I sort of hesitate to make any firm comment about those. And I think Eric, as Eric's pointed out, with some of them, and again they're different, we can see some biological changes that are not totally neutral. Although again with aspartame, not so much.
Great. So aspartame is a choice that for which there's plenty of data or sufficient data to not be too worried about it, and the others, we look for aspartame then, I guess, if that's the choice you're trying to make.
Better than sugar-sweetened beverage.
Better than, exactly.
A whole lot better. It's hard to be almost impossible to be worse than that.
Good.
Yeah, we did an analysis, just a rough analysis a little while ago. The obesity effect of sugar-sweetened beverages is huge. Of all the factors we looked at in the diet, it's an outlier, partly because the consumption is so high. Many people consuming many servings per day. And we did see that it looks like obesity has about the impact of current smoking in the United States, because obesity has gone up, smoking's gone down. The obesity as a cause of cancer is very important now.
Right. Yep. So Anna, based on that information, not that smoking and sugar-sweetened beverages are in the same category necessarily, but it sounds like the evidence is pretty clear that there's harm to be had from sugar-sweetened beverages. And so it seems like it might be a no-brainer to think about policy impacting that, but that is, of course, not the case. So could you comment on why it's so difficult to get sugar-sweetened beverage regulation or policy guidelines or things like that?
Sure. First, I'll say that while progress has been slow in passing those policies, it's been faster for sugar-sweetened beverages than it has for other areas of our diet. I think precisely because the evidence is strong that there are, few benefits and many harms of these drinks. So policymakers have tried and in some cases succeeded in passing policies to affect what we call the 3 A's that affect what you and I buy and what we decide to drink: affordability, how much things cost; availability, how easy they are to access in our environment; and appeal, so how tempting they are to us, how appealing they are. So we have seen efforts and again sometimes successes to affect each of these different levers. So with affordability, 9 cities in the U.S. now tax sugar-sweetened beverages, and those include some bigger cities like Philadelphia, San Francisco, Oakland, Seattle, and those taxes have been shown to reduce purchases of sugary drinks. To affect availability, many states have rules about what foods can be served in schools. So sugary drinks are often not available in schools. It's a way we can restrict availability. And then to affect appeal, we've had less policy progress in this area, but policymakers have proposed requiring things like warning labels for sugary drinks that would mimic the type of label we see on cigarettes or alcohol. For example, saying drinking these beverages may contribute to type 2 diabetes or obesity. So giving consumers more information about these harms. These policies haven't passed, but there's continued interest in them here in the US. But as you say, it's hard. people don't always want to be told what to do. People don't like taxes.
Yeah.
So we've seen some movement, I think, because of the lack of redeeming value of these beverages, but certainly room for progress given the harms that they pose.
So what kind of additional activities are required to move the needle a little bit forward? It sounds like there's some progress, but in limited geographical regions with limited warning label or kinds of things. What is it in your opinion needs to be done in order to first of all, have people understand the harms of sugar-sweetened beverages, but second of all, make policy clear to those people, to users?
Yeah.
And anyone can answer, but
sure,
go ahead,
I'll start, and would love to hear from Walter and Eric as well. I think it's passing any policy in the current environment is challenging. I think policies that enjoy higher public support are more likely to move along, and we're certainly seeing a renewed interest in nutrition sort of on both sides of the aisle right now, which is an interesting time for policy researchers. And we also know for some specific strategies like taxes, ways that we can increase public support. So for example, people in general don't like extra taxes. No one wants to pay more for their groceries. And we know that when tax revenue is earmarked for popular public programs, that public support is higher. So for example, Philadelphia earmarks their tax revenue for universal pre-K. And that's a very popular program in the city. And that sort of tying the revenue to something people really supported helped build enough public support for that policy to get it over the finish line. So I think the exact strategy will vary by the policy,
Sure.
but we do know some ways that we can try to boost public support. And then of course, in turn, policymakers are more willing to push forward policies they know their constituents want.
Yeah, great. And just while we're on that topic, and the same question, I guess, for alcohol, and we'll get to Walter and others, but it seems like there are unique situations for alcohol versus sugar-sweetened beverages, but there are some commonalities. That was a question. Are there commonalities? Are there things we can think about broadly in making these messages and legislative policy changes?
I certainly think the same tools can be used to affect those same three A's: availability, affordability, appeal. And we use some of the same strategies in alcohol control as in sugar-sweetened beverages, taxes, warning labels, et cetera. I think alcohol is trickier because it's the drug of choice for many policymakers, right? As Eric mentioned, more than half of U.S. adults are consuming alcohol on a regular basis. So I think we have a history of prohibition in this country. No one wants to go back to that. So I think there's more challenges with alcohol, but I think many of the same strategies in other countries and here in the U.S. have shown to be effective in sort of moving the population curve a little bit to the left, sort of nudging everyone to drink a little bit closer to the guidelines.
Yeah, great. Walter, your thoughts on this?
Well, I was just going to make the same point that Anna made already, but just to emphasize a little bit this point about using and designating the tax for some specific purpose. And there is, and it's encouraging, there is strong public support for nutrition and health programs for children. Not for adults necessarily, but for children. And like Philadelphia did, tying the tax with designation for those programs really makes a big difference. That was done in Mexico. But I think if we're going to do that, we really have to be sure that that's transparent and honest use of the funds, or else we'll lose credibility.
Of course.
In our state here, it's hard. I think when I've talked to policymakers here, they say it's very difficult to designate a use of taxes like that, which is unfortunate because that could really help support for. It's a double win, really, and the public can understand that.
And that's a Massachusetts thing, because it seems like I've seen other cigarette tobacco taxes in other states have been designated for very specific purposes. Is there a reason why that's a barrier that we can address, maybe?
I'm not a politician.
No,
but the
good.
public is wary, and they were correct in Massachusetts. The cigarette taxes got compensation from court cases worked its way back into a general fund, and people say, oh, it's just those politicians wasting their money, which I don't necessarily agree with, but that's a common reaction. But it really has to be an honest and transparent designation, or we will lose credibility, which would be really bad.
Yeah. And Anna, I guess all of these politics are local. It's something that would have to happen by state. Presumably other countries are doing something like this.
It certainly could be done nationally. There's no proposals to do that at the moment. So far, taxes have all been proposed at the local or state level and only been passed at the local level. Something like a warning label would be quite different. The path there is would more likely be federal. Those states and cities have some leverage to do it. So yeah, the specifics vary by policy, but there's opportunities at the state, local, and federal level to advance these policies that we know can be effective at reducing consumption.
Yeah, that's great. So we've said a lot of things. I'm wondering if we can summarize some of this by asking each of you, and I assume you all go to the grocery store, or someone in your house goes to the grocery store, and you're walking to the grocery store and you're trying to make a decision about what you'll drink. And it might be that, you'll tell us water, but let's pretend that you're sort of the average person who's trying to make choices. What advice can you give them? And maybe, Eric, if you want to start.
Oh, that's a lot of pressure.
Yes, it is. That's the point.
Yeah, I mean, I think a lot of these are personal decisions, and I've done a lot of work on other nutrition-related factors, and so people say, how much red meat do you have every year, or how much processed meat you have. Well, processed meat is also a carcinogen and WHO labeled, so I know that I would very likely skip the processed meat aisle and choose fish or beans or something like that as another form of protein. When you're choosing beverages, sometimes it depends on what do I want to make sure I have around just for everybody to have once in a while versus I'm having a meal and what I want to have to drink tonight. So sometimes it's like, oh, we're having fish. I'd really like to have a nice Chardonnay with that. Versus I'm having something else. It's like, oh, we like to have kombucha in our house once in a while, fermented beverage product that will impact your microbiome. And sometimes we like to have water. So I do think that it does sometimes come down to cost. That some of these things are the price of sugar-sweetened beverages sometimes is almost artificially low because the cost it makes to make sugar is now subsidized and all the other things that make it cheap to make sugar. So that it's almost like you're looking at a sugar-sweetened beverage versus water going, why is the water more expensive than your sugar-sweetened beverage? So sometimes it comes down to cost, saying, I'm on a limited budget, I'm going to choose things that are cheapest. And unfortunately, it's the processed foods and the things that are artificially sweetened that are the cheapest. So, I think it's very individual, and sometimes it's based on flavor and taste. Do you like your flavored seltzer, or do you like just seltzer, or do you like just water? And at least there's a lot more options now. And even for alcohol, there are a lot more options that are alcohol-free. So you can have a beer without alcohol. Walter and I occasionally go on bike rides, and he likes to have a beer without alcohol, which is great. I think restaurants now may not be great, but they almost always have an option which is without alcohol. So there's not a stigma of, oh, there's someone who just doesn't want to have an alcohol drink, whatever. You can have it, and no one will know. So I think it's nice that there are so many more options, and I think it's a personal decision.
Yeah, and I think just on that point, I'd love to hear the others' response too, but it seems to me that there's been a social norm change in alcohol consumption, like there has been for cigarettes, that it isn't necessarily problematic to be around a table with people saying, we're having wine and I just don't want any. And that social pressure, certainly in teenagers and others, is a driver of people's behaviors. I don't know if you all have seen social norms be different than they have been in the past with respect to drinking.
Yeah, let me quickly address that, because it was Jay Winston, who was on our faculty for decades here, who actually got messages about drunk driving and drinking while driving put onto sitcoms, put onto PSAs, and cut the amount of deaths due to driving from 40,000 down to 16,000 or something like that. So definitely was a social norm change 30 years ago about, we just know if you're going to drive, you shouldn't drink. I think there are many more social norms about saying it's okay not to drink if you go out with friends. And I don't hang around with a lot of 18-year-olds, so I'm not sure that social norm has reached down to that. And for that, we would need some of the messaging that Anna says. I mean, once we raised taxes with cigarettes, the 14-year-olds stopped smoking. And so that works. So sometimes social norms are driven by dollars or by messages. But I think there is definitely a change in social norms around alcohol now.
Yeah, Walter.
Yeah, maybe to take us back to the grocery
Yes,
store.
yeah, the grocery store, sure, yeah.
Asking, first of all, I wouldn't go for water because almost all places now, urban systems have good water, and it's monitored, and it's actually probably more reliable than the water you may pay a lot for at the grocery store. A couple of topics we did not talk about yet are fruit juice.
Yeah.
Back to the breakfast. In general, fruit juices have about the same amount of sugar as a Coke does, and so keeping the intake fairly low is, I think, a good thing. It's better to have whole fruit in general. With one exception, interestingly, we do see health benefits. It looks like some important ones and reproduced for orange juice. And so I do try to have a small glass on a daily basis there. But in the past, I was having fruit juice or cider as a basic beverage and realized I was getting 600 calories a day just that way, and that wasn't good. I wanted to cut out something.
Naturally occurring sugar, but it's
right,
sugar.
Yeah, right.
Right.
It was
So,
easy to get rid of that, yes.
To that point, sugar is sugar in this sense, that if it's corn syrup versus natural fructose in fruit, the fresh squeezed or whatever, we would
calories.
think it's calories. I mean,
Yeah.
if the goal is to reduce caloric intake for obesity prevention, then
Yeah, it does seem to make a difference whether it's fruit juice or intact fruit. And part of it is just if it's intact fruit, you consume it more slowly, you maybe chew it, take your time, and you have to think that if you're having a glass of orange juice, that's about 3 oranges, and you almost never have 3 oranges. So the amounts will tend to be lower. The juice, it's just too easy to put down a whole lot of calories and sugar that way. But it does, again, the fruit juices aren't all the same, but the vast majority of fruit juice is apple juice, grape juice, and they're not much more than calories, actually. And that then goes to the other big item if you go to the grocery store, shelves of these fruit drinks. Again, I won't mention names, but if you look at the label carefully, they're usually maybe 5% fruit juice, 10% fruit juice, which is really not much different to begin with. But those are, you really should consider those to be like your soda, your sugars. They are a sugar-sweetened beverage. And the amounts consumed are huge. And it's just, I'm struck when I go to a grocery store, just the vast amount of those beverages.
Well, and it's interesting, Anna, from a policy perspective, as Eric was saying, a lot of those are cheaper than the more natural or the whatever. So that's, I don't know if that's an economic, a commercial issue versus a policy issue, but you know, when you walk through the supermarket, how do you make those choices for yourself and your family?
Yeah, well, I will say that most soda taxes in the U.S. include these fruit drinks as well.
Oh, okay,
so policymakers are thinking of these the same way that Walter and Eric are. And thinking about these beverages specifically and how I think about the grocery stores is one thing we see in the data is that the marketing on a lot of these products can really mislead us, can make us think products are healthier than they are. So many of these products, including the fruit drinks that Walter's describing, include claims like all natural or 100% vitamin C. And this can cause us, we've shown experimentally, to, for example, think that a drink has less added sugar than it really does. So we make an incorrect judgment about a product. So policies can, of course, help address those issues, whether that's regulating what claims companies can make or requiring warning labels on especially unhealthy products. But in the interim, given how hard it is to pass those policies, it's important to read the nutrition facts label, which is not terribly sexy advice, but it does, as Walter mentioned, help you understand how much juice is actually in this product, how much sugar is actually in this product. Are there other aspects of it that help balance out some of those negative features like high sugar, high calories? So while we're waiting for these policies to make their way through the policy system, that's one thing I do is try to skip the hype on the front of the pack and go to the boring stuff on the back of the pack where we get the real information.
Yeah, that's very helpful and a great note to end on, because really what we're talking about today is for consumers to be informed about the choices that they're making and to think about it a little bit, not just look at a label that says natural or vitamin C and assume that that's better. To be informed about what's really in there, what you're actually consuming, what the caloric content, the nutritional content of any of these are, and make choices around your goals for your health and the concerns you might have about cancer or other diseases. And that's something that's not easy to do. Becoming informed takes some effort, but it certainly sounds like, from everything we've heard today, it will really pay off long term if you change your behavior structurally and make better choices. There will be benefits. So, yeah.
Yeah, Tim, if I can add a little bit, I'm always out recruiting for public health warriors.
Yeah.
And this isn't all about individual choices, which we've been talking about.
That's right.
Which is, it starts there. But where we have had changes in smoking and getting rid of trans fat, I worked on those a lot. Those did not start at the national level. The national level was the last thing to change.
Yeah.
It started in local towns, and then one town to another, and finally too many towns in the state, so the whole state went trans-free. Or you got local rules about taxation. And so I think, especially given the context that Anna talked about, that's where the action is. It's state and local. Really can be even institutional, even sub-local. And people can make a difference there. So.
Well, and we've seen that,
board.
as you've said, for trans fats and smoking. We can see the same thing, we hope, with beverages and the ability to individually make choices and advocate for policy that will change things for the better overall. So, believe it or not, we're at time. And so thank you so much to our panel and to the audience. Appreciate your thoughts, and we'll love to hear a little bit more about whether this was useful or not and how you might have started to make choices on your own and advocated for change in your communities. So thank you very much.
Thank you.